everyone. I focused on a case study on Haff disease. So, what is Haff disease? It is a rare syndrome of rhabdomyolysis caused by ingestion of a heat-stable toxin usually found in freshwater fish, such as buffalo fish, that develops within a 24-hour period after ingestion. Rhabdomyolysis is a medical condition that involves the quick breakdown or disintegration of damaged skeletal muscle. And when this happens, it usually releases intracellular muscle components such as myoglobulin, creatine kinase, aldolase, lactate dehydrogenase. Some common symptoms it presents with is chest pain, nausea, vomiting, myalgia, which is like soreness of muscle, shortness of breath, profuse sweating, muscle stiffness, pain to light touch, and back pain. And cases can range from being asymptomatic to life-threatening, and there are many different causes. Here are just a few fish that may cause Haff disease. We have the buffalo fish, the grass carp, and then the freshwater salmon. In this case, a 29-year-old black male arrives at the emergency department after eating a seafood buffet dinner. He presents with nausea, vomiting, diarrhea, and myalgia. Upon physical examination, he appears to be dehydrated. However, he has normal upper and lower extremity strength, as well as a normal gait or walk. He doesn't have any other remarkable symptoms. His vital signs indicate a high blood pressure and a high pulse rate, which are most likely due to his dehydration. He also has a respiratory rate on the higher end of the normal spectrum, as well as a slight fever. Based on these findings, what do you think the initial diagnosis was? The patient was initially diagnosed with gastroenteritis. So, as treatment, he was given 1 liter of normal saline fluid over 1 hour, a GI cocktail which consisted of 4 milligrams of Zofran and 20 milligrams of Pepcid, as well as 30 milliliters of Maalox orally. However, his symptoms did not go away after 2 hours, so additional lab tests were ordered. Hematology and chemistry lab results indicated a high white blood cell count, as well as low sodium levels, slightly low potassium levels, low chloride and bicarbonate levels. However, he had a high creatinine and high glucose levels, meaning this patient has hyponatremia, hypochloremia, and hyperglycemia. Lab results also showed an increased level in liver enzymes, both AST and ALT. Urinalysis using a dipstick method revealed a large amount of blood within the urine. However, upon microscopic examination, only normal levels of red blood cells were found within the urine, meaning that this patient either has myoglobinuria, which is myoglobin found in the urine, or hemoglobinuria, which is hemoglobin found in the urine. The urine sample also contained small levels of ketone bodies. Considering the patient's urinalysis results and elevated liver enzymes, a creatine phosphokinase test was ordered. This is an additional blood test that measures the levels of CPK within the blood, and high levels indicate that muscle, heart, or brain tissue damage has occurred. And as you can see here at the bottom, the patient had a very high level of CPK. Finally, the patient was given a point-of-care ultrasound. And what this is it's basically a portable or handheld ultrasonograph that can be used at bedside for a quick assessment or a diagnosis. One was conducted on this patient in the emergency department to examine his gallbladder for wall thickening, gallstones, and other biliary complications to determine if emergency surgery was required or not. However, his results indicated normal wall thickness and no pericholecystic fluid, sludge, or stones, meaning that his gallbladder was fully functioning and normal. So, considering the patient's high CPK levels, his elevated liver enzymes, the urinalysis findings, and his history of recent ingestion of seafood, he was diagnosed with rhabdomyolysis from fish ingestion, which is also known as Haff disease. He was admitted to the hospital and given 4 liters of IV normal saline fluids over a course of 3 days as treatment. On day 2, the patient's CPK levels and liver enzyme levels began to drop, and by day 3 he was discharged from the hospital as he was able to tolerate a normal diet and was not experiencing muscle aches anymore. So, why do you think the patient was treated with saline fluids? Rhabdomyolysis can actually lead to acute renal failure due to the released myoglobin from the disintegrating muscle tissue. This myoglobin then accumulates in the renal tubules and can cause obstruction. Thus, hydration via IV saline solution is administered to prevent the development of factors that cause ARF. These include volume depletion, tubular obstruction, aciduria, and free radical release. And here are my references. Thanks for watching.